How to become an EMT in 5 easy steps, brought to you by medicalfieldcareers.com. How becoming an EMT is a good idea. According to the latest statistics from BLS.gov, the EMT field is growing at 15% nationally. Therefore, enrolling into EMT training and becoming an EMT is a wonderful decision. EMTs, also known as emergency medical technicians and paramedics, are called in to emergency medical settings to care for the sick and/or the injured. The job is very important for people's lives are often saved by the quick thinking and work from EMTs and paramedics. A community is made much safer with good emergency medical technicians and paramedics, and it is one of the best medical field jobs to have. EMTs and paramedics are sent to the scene of an emergency by 911 operators, and they often work with the police department and the fire department. What is the process to become an EMT? Step 1, be 18 and have your high school diploma or GED. Step 2, finish an EMT training program. Step 3, have current CPR, BLS for healthcare provider or equivalent certification. Step 4, pass EMT cognitive and psychomotor exams. And step 5, get listed in the National EMT Registry. The step-by-step process to become an emergency medical technician. Step 1, be 18 and have your high school diploma or GED. It is a mandatory requirement and there are no exceptions. Step 2, finish an EMT training program. Finish an accredited state-approved emergency medical technician training program. Candidates must have completed the course within the past 2 years and provide verification of successful program completion on the National Registry website. Accreditation of paramedic programs is granted by the Commission on Accreditation of Allied Health Education Programs. The National Registry Board of Directors has identified CAAHEP as the single national EMS accreditation agency. The Commission on Accreditation for Pre-Hospital Continuing Education also recommends attending EMT training accredited by the CAAHEP. Step 3, have current CPR BLS for healthcare provider or equivalent certification. All candidates must have their CPR BLS for healthcare provider certification. It is the basic life support certification from the American Red Cross, and it is designed for healthcare providers and public safety professionals and meets a variety of certification and licensing requirements. Step 4, pass the EMT cognitive and psychomotor exams. The National Registry for Emergency Medical Technicians cognitive exam is a computer adaptive test. There are 70 to 120 different items on the test, and it usually takes about 2 hours. Topics covered are airway, respiration and ventilation, cardiology and resuscitation, trauma, medical, and EMS operations. Psychomotor exam is testing your actual skills at the job. You will be tested in all areas for the job, and topics covered are patient assessment in terms of trauma, patient assessment in terms of medical, BVM ventilation of the adult patient, oxygen administration by non-rebreather mask, spinal immobilization in a seated patient, spinal immobilization in a supine patient, bleeding control, shock management, cardiac arrest management, long bone immobilization, and AED joint immobilization. Step 5, get listed in the National EMT Registry. After completing your EMT training, all candidates must get listed in the National EMT Registry within 30 days of getting certified and pay the $80 fee to get listed. After getting listed, you are on your way to becoming an EMT. Before you go, check out our annual $1,500 healthcare scholarship. Come to our website at medicalfieldcareers.com and submit your 1,000-word essay on why you want to work in the healthcare field, and maybe you can get your EMT education paid for by us.